apprend davantage sur le variant Omicron. There's no doubt that the months ahead will require continued vigilance. The science tables modeling released today has shown us that cases continue to rise, even without the Omicron variant factored in. And while hospitalization and ICU admissions are currently stable, they too will grow. While we expected to see increases as we entered the winter months, the emergence of Omicron serves as a stark reminder of just how quickly things can change and how we must always keep our guard up. We still do not know very much about this new variant. We are still learning about its transmissibility, its severity, and impact on vaccine effectiveness. And while there are many unknowns, what we do know is that the basic public health measures are effective against COVID-19 and the Delta variant, and will also be effective against Omicron. As we enter the holiday season, I'm encouraging all Ontarians to avoid large crowds, practice physical distancing, wear your mask and wear it properly, wash your hands frequently, stay home when you're sick, and get vaccinated. If you have not yet received the vaccine, please do so as soon as possible. If you're eligible for a booster dose, please book your appointment and provide yourself with an extra layer of protection. Si vous n'avez pas déjà reçu le vaccin, s'il vous plaît, faites-le aujourd'hui. Et si vous êtes admissible à une dose de rappel, prenez votre rendez-vous afin de profiter d'une couche de protection supplémentaire. Achieving the highest vaccination rates remains our best defense against COVID-19. So, let's increase that community immunity as high as we can before the holidays start. Thank you. Merci.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Cynthia Mulligan at City News.
Hi, Dr. Moore. How concerned are you about what the modeling showed you today? And do you really see a chance that proof of vaccination can actually start being lifted January 17th? What is your recommendation, and do we need to take further measures?
So the modeling is disconcerting. We're seeing a continued rise in cases across Ontario and its impact on the healthcare system. And to me, as a public health physician, all of the cases, for the most part, are preventable. It saddens me deeply to see the vast majority of individuals in our intensive care units, they're unvaccinated. They never took advantage of the means to protect themselves. We know these vaccines are safe. They're effective. They will decrease the severity of infection in Ontarians. And it's absolutely preventable what is happening in our acute care sector. So I really would ask all Ontarians to reflect deeply. If you haven't been vaccinated yet, please reconsider. They are highly beneficial to you as an individual, to your family, to the community. They will decrease the impact on our acute care sector. The modeling is predicting a rise in cases, which I think we all knew would occur as we head indoors in crowded spaces and close spaces. I am concerned about the coming months and its potential impact on our healthcare system, and hence, our fate is in our hands. We can wash them, we can use them to put a mask on, and we can find the nearest clinic where we can provide the safe and effective vaccines. So the modeling is disconcerting, but I think we can prevent the major impact by adhering to all the basics that we've done in the last several months and 20 months of this pandemic. And I'm sorry, the second question?
My second question is, about proof of vaccination, it's supposed to start being lifted January 17th. So I'm wondering if you are recommending that, or if you're going to call it now and say that's not possible. And my question for Shauna Hunt, my colleague, is, what about rapid tests? One epidemiologist yesterday told me that they're being handed out like condoms in a safe sex campaign in Nova Scotia. Why aren't we doing something like that here?
So in terms of the proof of vaccination, we'll continue to monitor the data and make recommendations to government. A basic means of protecting individuals is stopping the mixing of unvaccinated and vaccinated. And if our cases continue through and after the holidays, we would make recommendations of government to continue the certification process in play. But we'll continue to review the data. We do have a very robust testing strategy in Ontario for the winter months. As we've released previously, we've purchased on a separate order 11 million rapid antigen tests for all students in Ontario, so high school and elementary. That's 5 tests each throughout the winter holidays. We also have a testing blitz that will be starting in the coming weeks that will go to high-risk areas where people who are vaccinated and unvaccinated are mixing, like malls. And provide rapid tests in those situations. We're also working together with our federal partners to broaden the testing strategy, and we'll have more news on increased availability of them soon. I also should sing the praises of our pharmacy partners who are providing asymptomatic testing with rapid antigen testings and PCR, as well as doing symptomatic testing at some sites across Ontario. That alone will increase the accessibility and availability of testing in Ontario. But we will use the best science. We are very much aware of the science table's review of rapid antigen testing and have had rapid antigen testing as a tool in school increased activities to keep them open, which is our goal as public health physicians and as educators. The target is to provide surveillance testing in schools if and when necessary, but also to stay testing for stay and play, as well as increased screening testing as we're having over the holidays. So it is a robust strategy that is rolling out in the coming months. We knew we'd need them as the risk increases heading into the winter, and you'll see increased availability of testing with a news release in the coming weeks.
Next question.
From Holly Mackenzie-Souter at the Canadian Press.
Hi, Dr. Moore. Following up on Cynthia's question about deciding whether to lift proof of vaccination, are you saying you're not going to make a recommendation until after the holidays based on what cases look like then? And if so, like why? What are you waiting for based on these projections that even without Omicron are saying we're going to see 400 ICU admissions next month, which is higher than what the government said today they can handle in terms of not sacrificing surgeries?
Well, we made a staged plan for January, February, and March, and it was to always review data, and we will review the data in the mid of January and make recommendations to government. But I can tell you we're meeting regularly with government and making ongoing recommendations to protect the health of Ontarians. One of them is the verification certification process, which I think has done us well in Ontario, protecting our businesses, keeping them open, and minimizing spread in those environments. I think it has proven its usefulness, but if there is a decrease in risk, we could make the recommendation to leave it up to the private business. But I assure you and assure Ontarians that this government has been data-driven. This pause alone tells us that they're responsive to any increase or risk or threat to the health of Ontarians, and will make the decision in a timely basis. I do believe the minister was asked questions like this in question period, and absolutely confirmed that this government will follow the data and if necessary, continue to have the verification process in play until such time that it is safe for Ontarians to remove that process.
Follow up.
So you're saying that you will not actually make a recommendation or decide on this until January, shortly before the change is actually going to take place? Like, I guess people are wondering because we haven't gotten from the health minister a firm answer. Like, when will you decide exactly?
So again, this is the government's decision. It's not my decision. We make a series of recommendations on public health measures on an ongoing basis to government. And with any rise in cases or rise in risk to the acute care sector or to the health of Ontarians, we make recommendations. So we meet on a formal basis at least weekly with government and make recommendations to them. But definitively, it is the decision of government to adhere to that roadmap that we've created COVID. I just want to assure Ontarians that they have been responsive to the data, and if there is a risk to Ontarians, this process will be maintained.
Next question.
From Anthony Fury at Post Media.
Hi, Dr. Moore. When it comes to hospital capacity concerns, can you update us on what the government and hospital system are currently doing to prepare for an expected surge in hospitalizations?
So you're seeing regionally that there's a differential effect of COVID-19 across Ontario. So areas like my previous hometown, Kingston, and Sudbury and Algoma in Sault Ste. Marie, they're being differentially affected. If their hospital system can't maintain the ICU capacity to care for patients with COVID-19, there would be transfers, just like there was from Toronto out to other centres when Toronto went through its significant wave and in the whole GTA area. So the health system is monitoring every single admission for COVID-19, every single hospital's capacity to care for individuals across Ontario, and if necessary, we'll have the typical Team Ontario response of the health system, where we'll move patients to ensure that they get the right care at the right time, at the right level of expertise across Ontario. That's cornerstone to our protection of the health of Ontarians. So the system is meeting on a regular basis to monitor this, and Ontarians should feel rest assured that they will be provided the right care if they need it, secondary to COVID-19. My preference as a public health physician, though, is that we reconsider, if we haven't been vaccinated yet, to get vaccinated. Even today, you'll get protected in the next 10 to 14 days. Your immune system will start to build a response against COVID-19, and if the 10% of those above 5 years of age who haven't been vaccinated, please reconsider. It's the best means of protecting yourself, protecting your family, your community, your workplace, your school, and minimizing your personal risk to be admitted to hospital over the holidays, and sadly, your personal risk to being admitted to the intensive care unit. You have a 23 times higher risk of being admitted to the intensive care unit if you are not vaccinated. You have a 13 times higher risk being admitted to hospital if you're not vaccinated. And you have a 5 times higher risk of getting the illness itself, symptomatic COVID-19, if you're not vaccinated. So those numbers alone should cause alarm, should raise awareness, and should cause individuals to pause and rethink why they haven't taken the benefit of these safe and effective vaccines to protect themselves and their family. The risk is going up. Now's the time to reconsider and to protect yourself and, frankly, all Ontarians and our health system.
Follow up?
Yeah, you mentioned measures that would be undertaken if a hospital system can't maintain their capacity. Given that we're talking about something that was anticipated around the winter season, and perhaps we still have whatever it is, 2 months lead time for it based on these projections, is there more that can be done to see that a particular hospital doesn't get to that situation?
Yeah, so that's where Ontario Health has a key position to play in terms of ensuring that hospitals don't reach their capacity. We're monitoring overall ICU capacity for both adult and children on a daily basis. Roughly, we're at 74% capacity, so only 74% of the beds are being used. So that's 1,700 plus beds across Ontario. We also can surge up for a couple of 300 or 400 extra beds if necessary, but that would potentially mean decreasing some surgeries. So there is capacity across Ontario already built in. We are moving into the holiday season when typically surgeries slow down, so ICU capacity should be maintained, and we should be able to provide care if necessary if there's a rise in cases. But I hope you're hearing it in my voice that these admissions are preventable. They're preventable by us adhering to our best practices of masking, hand hygiene, distancing, decreasing the number of social contacts you have over this next month. And please reconsider getting vaccinated. It's never too late to take the benefit of immunization to protect yourselves and your family.
Next question.
From Randy Rath at CHCH-TV.
Yeah, hi, Doctor. I'm wondering, are the new antivirals to treat COVID that are coming online, will they help to mitigate the problems with the healthcare system being overwhelmed by COVID?
So great question, Randy. We're monitoring Health Canada approval of these very closely, and we're in regular contact with our federal government, who could be making a purchase order on behalf of all provinces and territories. We're very much looking forward to getting further information on that. In terms of the timelines, I do believe only one product could be available in the first quarter. We're just hearing that as of today, and that may be available to us in mid-January. The other product might not be available to us in March, which I think is a bit delayed in terms of our response to this wave, but they could play an important role together with monoclonal antibodies to reduce the impact on our hospital sector. And we're working aggressively to, number one, procure them, number two, review their safety, their indications, their contraindications, and to make a seamless means by which anyone that is COVID positive, who's not been vaccinated, but could benefit from either the monoclonal antibodies or antivirals, make them accessible to them rapidly, because there's a narrow window by which these medications can have a positive effect on decreasing the risk of hospitalization. So we're working on that plan very aggressively and assuring that we'll be able to have access to an expanded availability of monoclonals, but also of antivirals.
Follow-up?
When you look at this big picture from 30,000 feet, say, is COVID something that we're going to have to learn to live with? Is this just not going away, and are we going to have to adjust our healthcare system to deal with it and maybe get vaccinated every 6 months for different variants? Is this something that's here to stay?
Really good question. I think many have raised the point that this is a global illness and that really we have to think globally. I would love to see increased availability of vaccines across to those that haven't received even their first doses at a global level. I think we're at 54% of the globe have received at least one dose. We have a long ways to go with the World Health Organizations and other international organizations to try to decrease the number of individuals in which this virus can mutate and or spread. Within Canada and Ontario in particular, I do see a day when we'll have low endemic rates of virus. We'll probably still need some international surveillance to look at if there's a change in this strain of virus over time, to make sure our vaccines are effective and our public health measures can work. But I do see a time when we'll have low endemic rates, and it will turn out to be like influenza or other winter respiratory viruses, where there's a seasonality to it, where it does have an intermittent impact on our healthcare system. And like influenza, you need an annual vaccine to protect against it. We may be able to, and I know many companies are, combine vaccines of influenza and COVID, and then create an annual means of protecting us against whatever the new circulating strain is. So that may take a couple of years to see that a low endemic rate, and then the winter effect, where the virus is most commonly active during November through to March. But that's our end game, is to control it, limit its spread and its impact on our mental, physical, social, and economic well-being. I do think we can get there in Canada and in Ontario, but we also have to think global on protecting against mutations of COVID-19 by maximizing our immunization or offering maximum immunization to all individuals on this planet.
Last question.
From John McGrath at TVO.
Good afternoon, Doctor. The modeling from the science table shows that even if we get up to 50% of the 5 to 11-year-olds vaccinated by the end of December, the ICU occupancy is going to be right at that threshold of 300 beds that the government says is the threshold for potentially pulling back hospital services, given that there's obviously margins of error for these kinds of projections, and that is, the needle being right on the red line. I am curious why you're not talking about any policy measures to try and reduce people's social contacts. Obviously, today you've urged people to reduce their contacts, but you urging that from a microphone is different from the government actually changing policy.
No, great question. So I want to inform the listeners, the viewers today, we're working very closely with our sister health units that are experiencing high rates of illness, and quite appropriately, those health units are putting in public health measures. So because it's so differential across Ontario, the impact on the healthcare system, we're working regionally and we're working locally. So I'm very pleased of what actions they put in place in Windsor to further limit the number of social interactions. And that is instruction on the Reopening of Ontario Act, so that it's enforceable. They're also looking at limiting potentially the verification certification process, a number of people in certain businesses. So we're working locally, absolutely aggressively through policy and through current legislation to protect Ontarians. And we've done the same in Algoma. We've done the same in Sudbury, and we're working very closely with the Medical Officer of Health in Kingston, Frontenac, Lennox, and Addington. So this is a different game now that there's such a different rate and impact on the acute care sector across Ontario that we're really having to try to put fires out where they come up, work very closely with those communities to limit the spread, and we'll continue to do that diligent and hard work with our sister health units. But I just want to sing their praises. They're being very responsive to their local activity. They're quickly putting in changes on the Reopening of Ontario Act that are limiting the spread, and we'll continue to work with them to ensure that communities are protected. And at the same time, they're doing very aggressive case and contact management to try to limit the spread, as well as further increase their levels of immunization. So your health units at a local level are working full out to protect you. They have our full support when they have to put in any change in the Reopening of Ontario Act or any orders under the Health Protection and Promotion Act. We're providing regular consultation, and I just can't thank them enough for what they're doing to protect their communities.
Follow up, and this is the last question.
The biggest surge in cases by age groups right now seems to be elementary school age students. Is the government, between the rapid tests that have been promised to parents and Christmas break, is part of the plan here to use Christmas break as a bit of a circuit breaker for cases, and between rapid testing and increased vaccination and 2 weeks out of class, hope that maybe resets things a bit?
That may. The other concern is that it increases the social activity of children. So it all depends what happens over the holiday season, and hence the reason we wanted to have tests in the hands of parents and children to ensure that if it turns positive, they take the appropriate actions to limit their social contacts and get the confirmatory PCR testing, and then public health will help support them as well. So we may get a bit of a circuit break for those 2 weeks, depending on how people use them and how many social contacts they have during that time period. I also would thank all the parents and children that have come forward to date that have gotten immunized. We're at 22.1% of those 5 to 11 years of age that have gotten vaccinated in 10 short days. I certainly would love to see that momentum continue. Even one dose will give some level of protection against Delta for these children, and potentially limit the risk of spread, and hopefully also getting their second doses in January with follow-up will also continue to make our community safer and continue to promote the safety of our school system. And also, we're working diligently with the Ministry of Education to review whether we have to put any other public health measures in place in schools to further protect them and keep our schools safe. I think it's clear from our associates, medical officers of health across this province, our schools should be the first to open and the last to close, and we're doing our utmost to ensure that our schools are protected. And with this extra level of immunization now at 22.1%, that gives me further confidence that we can improve on the safety of our schools through now the robust immunization strategy. If you just compare the secondary schools with the elementary schools, the number of outbreaks in the secondary schools are fewer, they are smaller, and the length of time that students have had to be out of school is less. I hope we'll have the same benefits as we improve immunization rates in our elementary sector that we've experienced in the secondary sector.
Thanks, everyone.